podcast focused on quality and patient safety, hosted by BW Healthcare World, jointly with Kaho. My name is Harbinder Narula. My guest today is Mr. Gaurav Loria, who is the Group Head Operations and Patient Experience and the Chief Quality Officer of Apollo Hospitals. Today, we will be focusing on something we call Beyond Care, talking about elevating patient experience through service excellence. Welcome to BW Healthcare World, Mr. Loria.
Thank you so much, Mr. Narula, for having me today on this podcast. I'm really happy and excited to be here today. So, thanks.
Mr. Loria, let me begin with a very basic question. Service excellence in healthcare is evolving rapidly. We've seen that happen in the last few years. How do you define uh, it in today's context, and what key factors contribute to achieving this?
I think, the whole lot of patient experience or service excellence, that whole landscape is really changing a lot. And it's just kind of changing largely for the last 4 or 5 years. Service excellence largely is all about ensuring a very seamless, personalized, and a very empathetic experience because hospitals are very complex institutions. Patients or people don't come there by their own will. They are forced to enter an organization like a hospital, and so the expectations are different. While it's, as I said, it's been changing, and it also is all about this experience at every touch point. Now, again, hospitals are complex, as I said, with multiple processes that are largely also manually dependent. So if we look at these processes and these systems, there are multiple touch points across any service or any process that happens in a hospital. From the time a patient enters the hospital till the time he actually leaves to a post-care follow-up. So if we consider that, there are many differentiating factors, like we are looking at experience today, of making sure that it's very patient centric, making sure that there are largely operational efficiencies around the process, so that your waiting times are reduced, your process outcomes are largely in a level that is expected by patients. It also depends on how empowered your frontline teams are and how engaged are they with patients. It also depends on how proactive is your feedback and communication to patients and their families. Uh, how have you made sure that you are accessible and your processes are accessible? uh, Largely shifting more from a reactive to a proactive approach. And also overall, what's your ethos are, what's your leadership and culture is all about in the institution. So I think experience has largely been moving from shifting from a one expectation or a perspective to a completely different perspective of late.
And Mr. Loria, things have changed in the in the past. There is more of information which is accessible, available to the patients. The patients are becoming more informed, and also, like you use the word empowered for your teams, even the patient seems to be digitally empowered. How have their expectations around service quality changed? Because what I feel is that they are now not just expecting, they're demanding the kind of experience that you are expected to give.
So today, if we look at actually, patients are no longer just some passive recipient that someone just comes, tells them what's happening with their care, what's the next step kind of a thing. But today, because of a lot of education and awareness, they want to become active participants in the care process. They want to understand how is convenience, transparency is actually available for them, how their experience is very personalized. So if we look at the larger sections of the patient's expectations, Obviously, as we said, of they being digitally empowered, it's all about speed and convenience. Today, if we want to, the world has changed so much in the last 5 to 6 years that anything is and everything you can get just at a touch of a button on your phone, and with as quick as within like 5 minutes or 10 minutes. So with that, I really don't want to wait for a doctor to see me, or I don't want to wait for a process. I don't want to stand in larger queues. So I think speed and convenience has become very important from a patient's perspective. As I already said, transparency and access to his information, I think that has become really very important. Largely the proactive communication and engagement, how the automated reminders are sent to patients, how they are reminded of their appointments, their process, that they need to do a follow up kind of a thing. How largely have we been integrating the whole digital piece with AI? Because today AI is the talk of the town. Everybody wants to do and be a part of this change. So how does it largely impact patient care, his outcomes, and his whole environment? you know uh, how can we put in the higher standards of empathy and services which patients really expect these days? It's just not about you just come to a hospital, you get treated, but it's also about the larger environment as to how clean your system is, how approachable your system is, how empathetic your system is, and how transparent and digitally advanced your system is. Also, you know how how are you valid, or or is there a proof for in your social presence, that in your social media there is a talk about your institution, about your outcomes, how people are looking at it. And obviously, last but not the least, there is a chunk of population that is also considering and looking at how their medical information is private and it's secured. So if we talk of digitally empowered patients, I think there are multiple pieces that have been changing, that will continue to change, and what patients largely are looking at today.
I absolutely agree with you that the moment we are moving towards the digital piece, a lot of it also kind of triggers a sense of responsibility to ensure privacy of data, etc. Mr. Loria, you know, patients' expectations are there, and today some of the expectations may just end up being unreasonable as well, because there's a very thin line between the care and the add-ons that they wish to receive. What are some of the biggest gaps between patient experiences and the actual service experience in the hospitals today that you feel need to be bridged?
So I think that's an amazing question, and I think that's largely the problem that all of us are trying to address. Because experience is moving up. By the time we reach to that level, it moves to the next level, and then we reach to the next level. It's a continuous fight. It's a continuous struggle that continues to happen. It's good in a way because it pushes organizations or healthcare delivery systems to push to higher levels and improve their services. But I think sometimes it becomes, do you really need to do this? Or, is the core of the business or core of what you are offering to a patient, is that important, or are these frills really important? But considering today's environment, yes, I think the educated, empowered patient looks at everything. Because a lot of times, when they walk into a healthcare institution, they assume that my clinical outcome is guaranteed, because that's the promise they expect a hospital to make to them. And it is somewhere in the background that it is there. So, clinical outcome is there, clinical process is there. But then what I expect more is, I don't have long waiting times, and you are a very efficient organization, that you don't make me run for my discharge process closing. You don't make me keep reminding you 20 times to get my food or get my washroom cleaned. I don't have to I don't have to wait for
Mhm.
longer to see a doctor or, get my test results. But what is happening in reality is many hospitals are still struggling with that because there is a behavior change that is required at the back end. There is obviously integration of technology which is required, and there is somewhere or the other, everybody to get on the same page with a clear objective, with a standard understanding that this is what our objective is and we want to deliver. I think that is missing somewhere. And if we look at few of the other examples, where gaps are there, one of them is definitely around digital convenience and manual processes. While patients look for, a lot of patients look for, or there is a percentage of patients that look for more of digital interactions. As I said, that I just want to pay the bills from my own phone. I don't want to kind of do this by standing in a queue. I just get my reminders, I just get my reports on my phone, and I don't need printouts largely. While there are hospitals that are still relying on paper-based processes, they still don't book appointments, kind of a thing. So that's the gap. The third area, if we look at, is standardized care versus personalized care. Patients are looking for personalized care today. That their care is managed and their services are managed based on their history, their preferences, and their concerns for a very tailored and a specific experience. But many hospitals, what they largely look at is one size fits all, or what I think is a process is the best process. Not understanding, for a patient, those 10 steps may be really difficult, which you need to cut it down to 3 steps. But as a hospital, because of lot of other issues or challenges that I have a back end, I may have designed my process like that. So, that is another area. The fourth area that largely we can talk about or look at is transparency versus unexpected costs. If we don't have a process, so the patient expectation is that obviously there is transparency in billing and the whole care process that's happening. But if we don't establish that, we don't update him on a daily basis or on a particular stepwise process, it becomes a challenge. And then again, it's like you are breaking the service promise that you may have given to the patient. It's about proactive communication versus lack of updates that are provided to patients, be it about his care, about his status, or be it about his billing, or any of the other processes or systems. It's about expectation on compassionate communication versus very rushed interactions. Because if we look at the volumes and the numbers in a hospital, and in how busy environments everybody is running and working, somewhere it looks like that I'm rushing. So for example, we always have this dilemma. We always so there are times when we receive such complaints wherein patients say, oh, doctor in the outpatient department did not spend enough time with me. But from a doctor's perspective, it's like, oh, this patient seemed to be fine, or I didn't have to spend so much of time, but I saved that time for somebody else who actually needed that time from me. So it's always a dilemma between the expectation and the actual reality meeting there. And the last but not the least is about a coordinated care versus a fragmented approach service. So while the patient expects that my care should be seamless and coordinated, in a true hospital scenario it does become fragmented at times, because there are so many pieces that they are that are working in, and they need to just be working in a perfect systemized approach, that even there is one slip, it just delays the process or gives patient a fragmented approach feedback. But I think managing all these systems, the processes, the ways patient care is looked at, I think it's a very very challenging aspect, and hospitals really struggle with it, be it the best of the hospitals or be it the smallest hospitals.
You know what, Mr. Loria, I was kind of visualizing the challenge that in a restaurant, I mean, it's a very different analogy, but in a restaurant, the waiter gets stuck between the guest and the chef. Same thing, I can understand what you may be going through between a doctor and the patient. These challenges could be very, very similar. But that brings me to my next question. What you understand the problem now, but what strategies is have you kind of executed or are implementing to elevate the service excellence across multiple hospital units? Because it seems like a very simple task to do in a small setup, but when you look at a hospital, the whole the challenge around executing and implementing this strategy becomes large. But in your case, it's not just a hospital, it's a group of hospitals that you have to execute and ensure that the standards are very similar of what you expect in one hospital versus another hospital of the same group. So how are you being able to do it?
I think again, thank you for that question. It's just it's just something that we deal with it on a day-to-day basis, because hospitals that have evolved at different timings, under different circumstances, and they operate in different environments. Patients' expectation of a patient who's in Mumbai and Hyderabad versus someone who's in Karimnagar and Nellore are completely different, and making sure that you are still living up to their expectations. I think that's a continuous challenge that we deal with it, but we have definitely put in standardized mechanisms and systems. So Apollo's ethos has always been, and this is what chairman coined the term, saying tender loving care, that we need to provide TLC to every patient that walks into the doors of Apollo hospitals, any of the Apollo facilities. We have constantly been making sure and trying our best to meet up to those expectations. And there are times when we slip, there are times when we fail. But I think what is important is that what are we learning from that, and how are we ensuring that a similar failure is not faced by any other patient in terms of experience or service. The other thing which we also need to kind of keep in mind or in the background is that, our staff keeps changing, for the fact that the attrition rates in hospitals are pretty high. No matter how great our systems are, no matter how great our salaries are, but then ultimately it's, the healthcare world is small, but then people keep moving, and the whole attrition, and then it becomes a more challenge to make sure that what you want to implement is continuously implemented at all times. So what we have is, something called as being kind, or kindness, as our mantra, which we picked up like 2 years back, and which we have been taking up as our theme for the year, as something like, as part of our annual operating plan. So while we focus on a process, making sure that our processes are broken down, you understand where your touch points are. If this process has got a touch points of 6 for patient, how can I reduce it down to 3? And that's a constant process, evolution that we try to look at, whether it is by using technology or by removing waste systems or waste processes in our system. Look at that bit of it and have a calendar of activities that we want people to do. Next bucket would largely be about people. So how do we kind of train our people? How do we keep a tab on them and make sure that they also have the same vision that our chairman has, and that our annual operating plan for the year wants us to focus on? So I think that's something that we continuously strive to look at. And one very important thing in that is empowered frontline staff. For them to go ahead and take any decisions, for them to make sure that ultimately patient or their family is happy. While clinical care is important, communication is important, but the other services that we offer are also important. To look at how are we using technology in our whole system, in our whole process, at every touch point or wherever possible, to make sure again that patients are continuously updated, they are aware, and how are we cutting down on these processes. And last but not the least, what we focus on is the whole ambit of governance. how do we collect patients' feedback? How do we act on it? And very interestingly, we started something like what is called, we call it as a kindness score, wherein we ask patients how kind were we, at different steps, at different processes. We started this a year back, and our push is continuously to improve on that score. How do patients see us as? We may not be able to provide that service that the patient may expect at certain situations or times. But then were we kind? Were we empathetic towards them? And I think that is something which is really, really important that we look at in addition to the patient feedback and, kind of acting on it and closing those loops.
And Mr. Loria, would you like to share some examples of how the innovative patient experience initiatives that you are executing have had a significant impact on the patients in Apollo?
So yes, I think I can talk about tons of initiatives that we have actually been taking, but simply to what we did was we kind of developed or designed a future patient process for both inpatients and outpatients largely, and then we started working on, as I said, identifying the touch points, cutting them down, or using technology. So some of the examples being that patients able to book their appointments online, having chatbots to help them so that they don't have to wait, sending them reminders largely about their appointments, and when they walk into a hospital, giving them digital maps or places where they exactly need to go so that they don't have to largely ask anybody where they have to go. Capturing their preferences. Would this patient would may require a wheelchair or a stretcher when he comes to the hospital? So making sure then that gets organized and is available when the patient comes in. Or, this patient did not have a good experience at this place, what more? So largely capturing those things. Making sure that as soon as a doctor kind of gives a prescription, that prescriptions goes online on his application so he can access that prescription. That prescription is with the pharmacy and with the diagnostics and with the billing and everyone, so that he doesn't have to keep showing his prescription everywhere, but his information is available. And so for example, if it comes to pharmacy, getting these floaters in so that patient doesn't have to stand in queues in the pharmacy, they can just place an order, and while walking out of the system they can pick up their medications. Making sure that patient receives a link on his phone and he can do the billing from that link itself, so that he doesn't have to go again to stand in a queue. So like this, there are multiple examples that we have actually looked at. A lot of these have been implemented. For some of these, we are in different stages of development and implementation. But these are some of the things on how we are really making sure that we are looking at all the pieces to make sure it matches with patients' expectations to some extent.
Uh, Mr. Loria, this is brilliant because what it brings out is that some of the things that really make a difference are very, very simple things. And they not only
Yes.
create a patient experience, they also build efficiency in how you are managing the operations. Mr. Loria, AI is being spoken of extensively today, and especially in the field of healthcare. Now, AI and automation are transforming healthcare interactions. How is your organization leveraging AI to improve some service excellence and enhance the patient experience? I know you spoke about how the sharing of data is actually building efficiency. Is there beyond that?
Yes, there is a lot more that's happening actually, and I think to tell this out here, our joint managing director, Dr. Sangeeta Reddy, she's the one who largely kind of focuses and gives her personal time when it comes to AI, because she's deeply interested and in it. So we have been building a lot of AI tools, but largely, if we look at the smaller pieces of it that we use from a patient experience perspective, I think they are about the chatbots and the virtual assistants that we use for booking appointments from a website or connecting with the patient. We do look at modules or applications where we have speech to text, especially for the doctors when they are doing digital prescriptions for patients. From a patient feedback perspective, we do look at their sentiment analysis as to which are the focused areas where we really need to push our efforts on or spend some time on. Predictive health analytics is another big space that Apollo has been working on largely in predicting your health scores, your cardiovascular state, your state of your brain, and some of the other functions. And we have worked with even Microsoft and we are working with some of the other bigger institutions on this. And now we are also started, and we have kind of started building simulation labs for our team so that they could be trained, where we are looking at on how can we use these AI driven tools and simulation tools to train our staff, use those case studies, and do continuous skill enhancements, so that they are up to the mark. So there is a lot that is happening in the space, be it clinical or non-clinical. But again, we need to be very clear on how this really makes a difference in patients' life. And rather than using everything, focus on what patients need and where would they largely be used.
And service excellence is not just about systems, and when we talk about people, we also start thinking, the first thing that comes to our mind when we are looking at a hospital is the doctor, the patient, the nurse. But there are so many more people working in an hospital. From the time a patient reaches the hospital, they have to go park, the guy who opens the door, the guy who's taking your the payment. There are lots of people involved in building an efficient hospital. How do you engage the frontline staff in delivering the exceptional patient experience so that it is not just limited to a doctor or a nurse?
I think it's a continuous process. It needs to be really done. And as I said, that we need to engage with our teams from the day they come into the organization, they join us, till the time they are with us, and then that cycle just goes on with other people. So I think that it's a continuous process, and what we have is a very standardized induction process, telling them about our ethos, our focus, our mission, our vision, what is important, and being kind. That is a very critical aspect to patients, and how to be empathetic. Having largely our strategies and goals defined, ensuring that there are workshops. We have even gone, and we also conduct even psychology workshops for our staff members, because for them to understand how important it is from a patient's perspective. For me, sitting in an ICU, I may be seeing 20 patients every day. But for that patient and that family, that one patient is important. So, it's not a very monotonous job for me, but how to make sure that I'm empathetic and I understand how important that one person or one human is. So I think we have been conducting a lot of these kind of workshops as well for our teams, and obviously the trainings and a lot of awareness on the ground. We do have like a weekly kindness activities. Every Friday, we ask people to, publish their stories, what they have done in every week. And we have been doing this for the last almost 3 years now. We have more than 10,000 stories, which we even published with HarperCollins, about 2 volumes of it, called Smiles Behind the Mask, on to what extent our staff goes to ensure that they are kind and they are empathetic for patients. We do have open forums, we do have huddles. We encourage our people to, kind of take initiatives, make sure that if somebody is not happy, then how do we do the service recovery, or how do we try or make an attempt to come up to, at some point, to the expectations largely of patients. There is a continuous effort to make sure that the cross department collaborations are working well, so that what patient sees is a very smooth process, and then largely an experience. We do look at many mentorship programs, multi-skilling of staffs, and recently what we also started was a step up program wherein we elevate skills of our team members. And the one of the other examples in this is also about simulation labs that I just spoke to you earlier about. So I think a lot of these things that we continuously do and obviously provide a weekly and a monthly data to all the hospitals for them to know where they are falling short of, what needs improvement, so that they don't wait for the end of the month to get that data, but it's a weekly analytics that just goes out to them. What's the voice of the customer? Out of 500 feedback, which were those 2 3 areas where you saw, so those kind of word clouds. So there's a lot that happens on that front to make sure that people are aware, and we support them either with data or training or technology so that they could run effectively and efficiently on ground.
Mr. Loria, my last question to you is that, any initiative for it to succeed at a sustainable level, for it to have longevity and you don't have to push people to do that, it must become a culture in the organization that everybody is a part of. That's what is expected when everybody is uh, performing whatever role they are in the hospital. Now, what are some of the best practices that you have, brought to Apollo for building a strong service culture in the healthcare organization that you are representing?
Thank you for that. And I think the first bit of it you already answered in your question. It's about the culture. It's about establishing a clear service vision by the leadership, and they being the role models for that. And I think that really very beautifully happens in our institution. It's about their commitment and their role modeling, as I said. It's about having a clear strategy for the year, which we call it annual operating plan. And there is a clarity in what are we going to execute, how are we going to measure it, how are we going to incentivize it, or, what are we going to look at what point of time. So there is a clear expectation and a way to deliver that expectation on the ground largely. I think it's very important to have a very comprehensive training and a development program with a clear oversight and governance on what's happening on the ground, so that areas where we need to improve continuously gets fed into the training matrix for people to understand where the focus needs to be. I think it's important for the employee engagement and rewards, so that there is a very healthy competition. So we generally do ranking of all the hospitals, which gets released every month, and people really want to be on in the top five or top three, even if they slip by 3 points. So there is a proper system that is set now, and it's a very healthy competition. And it even happens at the at a hospital level, where in different wards, different departments are at some kind of ranking and looking at how can they further improve, fostering a very clear communication channel and a mindset for patients. I think that's something which is again very important, and everything needs to work around it. Obviously technology and innovation, which is a very continuous process that we need to look at. uh, Focus on employees well-being. And I think we kind of, as healthcare institutions, we miss out on that. But our chairman is very clear. It's not just about getting, which he himself wants to see the overall report of the organization of 65,000 employees every year, is how healthy his people are. So there is a forced health check, if I call it that way, is that people need to undergo every year, which he's very particular about, that his people need to be first safe and healthy to take care of patients. So I think that, in addition to adding, for people's mind well-being or the psychological well-being, I think that's important. Data driven decision making, wherein you look at data and then you decide what needs to be done, and largely about understanding the gaps and working towards these gaps. But overall, a common understanding that patient is at the center of everything. Whatever you do, whatever new process you design, wherever you want to invest, just close your eyes for 2 seconds and think, is it going to impact the patient? Yes or a no? And then based on that, you move forward or you hold back your thoughts. So I think that is something which is really important, as clear strategies or clear principles that any institution, if follows, would result definitely in a successful outcome. While these may be there, but then at different stages, but as long as we are pushing and we know that we need to move towards it, I think that makes the whole difference.
Mr. Loria, this has been such a meaningful conversation because, it's important to understand the perspective of not just the patient, but also of the people in the hospital who are there to create that experience for the patient. And, as we were discussing that today, the patient is more empowered today because he has a lot of information available to them. And that sets the expectation in their mind. But what sets an institution apart from everyone else is when the culture of being able to serve the patient with empathy and kindness, as Apollo does, becomes a part of their daily being. So I think that's a very meaningful, thing that actually emerged from this conversation. Thank you so much for speaking to us at BW Healthcare World and being a part of this podcast.
Thank you so much for having me today. Even I love the conversation, and I hope and I look forward to having more of these conversations with you. So thanks once again.
Thank you so much, Gaurav.